Okay, thank you very much. And I believe this is a very interesting topic because oligometastatic patients are considered patients that are long survival compared to almost patients that do not have bone metastasis or no lesion in general. As you can see from the study, the survival is much better. Now, one of the thought that we have is to treat specifically those kind of patients because because we believe we can get enough power into the lesion and to destroy completely the lesion. So we enroll patients with prostate cancer, with metastasis on the bone, and having 1 or 2 lesions. The definition of oligometastatic patients really varies a lot among the studies. It's generally accepted less than 5, but in our study we limited to 1 or 2 lesions. We selected specifically the patient with prostate cancer because there were 2 measurable elements outside of the pain. That was the PSA value and also the PET scan that they are doing. So as you can see, the local tumor control was basically done out of those measurables, and pain response in terms of VAS score. Now, you can see that we enrolled just a very limited number of patients, so we ended up having 11 patients, and all patients had some kind of treatment on the prostate. 5 of them got radiotherapy, 2 radical prostatectomy, and in terms of the bone lesions, 6 patients already got radiation on the same lesions, and 5 patients we treated as the first-line treatment on the bone metastasis. As you can see, after the treatment, we got beautiful results in terms of reduction of the mean value on the PET-CT, and that was actually very dramatic and something that all the patients really did appreciate a lot, along with the oncologist. And also the PSA level did dramatically drop, and indeed those patients were having that situation of, I call it downstage of disease, even if the oncologists don't like very much this wording. But as per my understanding, they used to have a bone lesion, so a metastasis, and they are metastasis-free after the MR-guided focused ultrasound treatment. As you can see out of this closeout, that's a lesion from one of the very first patients that we treated, and the PET analysis also was very, very good. Another patient, this is actually a pediatric surgeon who had this lesion sitting there for years, and he was not able to get rid of the little pain that he had, but specifically the fact that he had the lesions. Being a doctor, he was always thinking on that lesion on the scapula, and the PSA value was always too high to his mind. So we treated, and in a single session we were able to completely destroy the lesion, and the PSA dramatically dropped down, and he was so happy with the result, and he is still happy. I mean, he updates me every once in a while, and he sends me the screenshot of the PSA, because he told me my PSA never got so close to 0 after I discovered to have the prostate cancer, and that was just the first time that he saw multiple 0 prior to another number on the PSA. And also the survival analysis is very, very good. We had an estimation progression-free survival of almost 53 months, which is actually very good. Again, this is highly selected population, but I think specifically in that domain, we can make a huge difference. So I encourage all of you that have the opportunity to treat bone metastasis to look for oligometastatic patients and indeed propose a treatment. So in conclusion, it can be brilliantly efficient and safe therapy for tumor control of bone metastasis when we use focused ultrasound in patients with oligometastatic disease. Thank you very much for your attention.
Any questions? Okay, one question here.
Yes, first, congratulations for this wonderful study. Did you have the opportunity to see any abscopal effect on a bone lesion? Because we've seen in lymph nodes or in liver metastasis or liver, but in bone I've never seen it. Have you seen any of those?
I don't have direct experience on that. No, in my experience, I never had some abscopal effect. I don't know if others here had. Patient, not even you? Matthew?
No.
Thank you.
Thank you.
Alessandro, quick question. What's the recovery like for a patient when you do this treatment versus a periosteal palliative treatment?
It's the same, absolutely the same. Apart from a single patient that developed pain on the treatment site, for the rest is largely the same. I mean, we tend to have the patient hospitalized for one night because for multiple reasons, we like it. But I mean, the day after they go, and most, I mean, 98% of the patients are fine the day after. Even if we, during nighttime, we give a lot of steroids, and depending also on how much aggressive I was in treating the lesion. But steroid is always following the treatment, and quite a high dose, I would say.
Thank you.
Do you do the same, Alberto?
More or less. Not that much steroids, I mean.
Yeah.
Just those that are needed. Yeah.
Okay. Great, thanks.
Thank you.